Hi, I'm Pat Awesome. I'm the Director of Clinical Content and Development at Center on Addiction and the Partnership for Drug-Free Kids. Our organization helps families either protect their kids from substance use and or really help families who are struggling with a child. And when I say child, I mean a child of any age. We've had people come to us with their 44-year-old children looking for support, but to give them the tools and strategies to help them navigate substance use. And I'm here today with Dr. Sarper Taskaran. Sarper's from Child Mind Institute and has helped collaborate on this guide, which we wanted to talk about today. It's Substance Use and Mental Health in Teens and Young Adults, your guide to recognizing and addressing co-occurring disorders. The reason we collaborated on this is because substance use and mental health issues often partner together, and they can be incredibly difficult to treat. And we know that families can really struggle with recognizing the risk factors, understanding how to find treatment, how to get their kid to agree to go to treatment and take medications or comply with whatever is being recommended. So there wasn't a lot of information out there, and it's something that we've been talking about collaborating on for a while. So it is our first product. Looking forward to doing many more. But with that, let me turn it over to Sarper.
Yes, thank you, Pat. I'm Sarper Taskren, and I'm a child and adolescent psychiatrist at Child Mind Institute. Let me tell you a little bit about Child Mind Institute. We are a nonprofit, and we provide gold standard clinical care. And we're based in New York City. We also do a lot of school outreach, and also we provide research, open access data to better understand brain development. So our partnership is about bringing together mental health disorders and substance abuse, because truthfully, when these two problems co-occur, it is a recipe for disaster, and you can't really treat it as if they're in a vacuum, because you have to have a complementary approach when you're addressing those two. Substance abuse poses a serious risk if it's untreated for mental health disorders, and likewise, mental health disorders are known to cause substance abuse when untreated. So this is our opportunity to partner and bring different institutions together to work on this important issue.
Yeah, and one of the things that we share in the guide is the prevalence, right? So the prevalence rate for co-occurring disorders can be anywhere from 30 to 45% for kids that have been diagnosed with mental health disorder, and it's even higher if substance use comes first. So, and as Sarper said, getting the right treatment is really important. The guide itself has some interesting sections to it, because in addition to the overview, we talk a great deal about each specific disorder, the ones that are more common. So it's anxiety disorder and substance use, bipolar disorder and substance use, and so forth. And then there's a section on families and what families can do to get someone to engage in treatment, and how to really find quality treatment, which is very, very important. Because there are a lot of places out there, by the way, that will say that they offer co-occurring treatment. And when I say co-occurring, it's anytime there's substance use and mental health together. Some people call that comorbid, or you'll often hear dual diagnosis. But the bottom line is there are a lot of different treatment facilities that are out there that will say they offer co-occurring disorder treatment. And what it really means is there's a nurse on hand to hand out medications or something like that. It's not comprehensive treatment, which we'll talk about in a little bit. But wanted to just give you an overall sense of the sorts of topics that are in the guide. You can download it from our website as well as the website at Child Mind Institute to take a look at it. But for today, we thought we'd answer a couple of questions that we've received from the audience. So let's see. The first one was about, let me just check here. What is a substance use disorder? And when would a parent know when substance use becomes a real problem or defined as a disorder? That's such an interesting question, because substance use runs the gamut from someone who really doesn't use substances at all or may have experimented with substances, all the way through someone who has a severe substance use disorder. Also, some people would call that addiction, and into recovery. And at the Partnership for Drug-Free Kids, we look at trying to help parents from this perspective of, I just found out my kid is juuling, right? All the way through to, I have a daughter who's pregnant and she's using IV heroin. So substance use disorders really fall into 4 different categories. One is impaired control. So that might be where someone's experiencing cravings, or they want to continue, they spend a great deal of their time looking for substances, trying to find it, use it, and then recover from it. Impairment of social relationships often occurs where they're having arguments with their parents or having problems with school in terms of their substance use. Another aspect is risky use, where they're using in spite of their mental health problems. So as Sarper said, you can really end up in a situation where if you have an anxiety disorder, it will become worse with substance use, even though at the time that someone's using substances, they might think that it's helping. And then there's also the notion of tolerance, meaning that I need to have more and more of the substance, whether it's alcohol or other drugs, in order to get the same effect, or I have withdrawal symptoms. So those are the main categories. What's important to note is that there has to be some kind of distress in the person's life as a result of it. So if a family finds a jewel in their kid's backpack, that wouldn't necessarily qualify as a substance use disorder. But if that child continues to use the jewel, gets caught at school, and there are things like that as problems, then it would be diagnosed as a substance use disorder. So was there anything you would want to add there, Sarper?
No, I think you covered it well. I think when we're talking about substance use disorders, it's important to know that a child or adolescent doesn't have to go through withdrawal or doesn't have to go through craving. So it doesn't have to be, there shouldn't be severe physical signs in order for us to call it a use disorder, because if there's enough clinical impact, if the child's school life is affected, if personal relationships or peer relationships are affected, and if the individual can't really function at places that he or she used to function before, then there's a significant impact of the substance, which means that the teen has substance use disorder.
Okay.
Yeah. So let me jump to the second question that we have.
Okay.
All right. So how does substance use increase the risk of mental health disorders and vice versa? So this is something that you addressed. Substance use significantly increases the risk of mental health disorders. People who have substance use, 65% of them have a mental health disorder. And this could be anxiety, this could be a severe mental health disorder like psychosis, this could be depression or other mental health problems. And vice versa, a lot of mental health disorders can cause substance use. 30% or 40% of kids who have a mental health disorder will revert to substances in order to alleviate their symptoms or to get themselves to a better place, which is also called self-medication. What happens is, depending on the substance itself, for example, marijuana, chronic use, and significant marijuana use over time can induce psychosis, and it can cause a psychotic break. Marijuana can also induce manic episodes in individuals who are prone to illness. We know that alcohol, for example, is repeated chronic use of alcohol can lead to depression, can lead to mood disorders, can lead to anxiety disorders, and also can lead to hallucinations. Misuse of ADHD medications, such as psychostimulants like methylphenidate or amphetamines, can cause manic-like symptoms, and also in high doses can induce psychosis as well.
So I'm going to just interrupt you for a second. It might be
Sure.
helpful if you explain what psychosis or a manic episode, like what would somebody see if that were to occur?
Sure. A psychosis is basically a break in an individual's perception of reality, and it is a dysfunction of organization of the mind. So, a psychotic individual might have delusions, might have fixed beliefs which are not true. They might be paranoid. They might
Okay.
be suspicious. And they might also experience some perceptual disturbances, such as visual hallucinations, seeing things that are not there, or hearing things that are not there.
Mm-hmm.
These could be a direct result of the intoxication itself. For example, inhalants at times, or some substances like ecstasy can cause this condition when they have manic, when they have a bad trip.
Okay.
And this is in the time of intoxication. But they can also cause this problem with repeated and chronic long-term use. Even when they're not using it, they might experience these problems.
Okay. So, the curious thing I think for some people is why is it that some people will experience the kinds of problems that you just discussed and
Mm-hmm.
others don't? So, I think about brain
Mm-hmm.
development
Mm-hmm.
from, we have research that shows that from the time a kid is, I don't know, roughly 10 or going through
Mm-hmm.
puberty through their mid 20s or perhaps even later, there's some more research out now that would say maybe 30 years old, that the brain is still undergoing massive development. And so throwing substances on top of a developing brain can be a recipe for
Absolutely,
disaster.
Pat. I think one thing that we need to make sure is to protect the brains of youngsters as much as we can until their brain is developed enough
Mm-hmm.
to protect itself from the impact of these substances. The drugs, for example, nicotine or alcohol, changes the wiring of the brain as it's being developed. So their brains will never be the same, meaning that when they are induced or when they are exposed to substances at an earlier age, they are more at risk of developing a substance use problem in the future. If, for example, chronic alcohol use before age 15 is linked to 6 times more increase in substance use and alcohol addiction in the future.
That's a lot. That's a lot. And I think there are other risk factors that are particularly important. So, a family history, a genetic history
Mm-hmm.
of substance use,
Mm-hmm.
any kind of trauma that a child might have experienced early on, whether it's abuse or neglect. Certainly, there's some studies that show maternal well-being relative to, like if mom has depression, it could be linked to a higher risk factor for someone both developing depression as well as a substance use disorder. So it's
Mm-hmm.
really important, and we've laid out in the guide some of those risk
Mm-hmm.
factors for families to be aware of.
Mm-hmm.
So, well, why don't we go to the next one? If you've got it up, I'll let you read it.
Sure. Okay, so our next question is, how can parents help young people who want to get help for substance use or mental health disorder? And how can parents get their teens who don't want to get help? How they can provide
Yeah, I like the first
support for
question
them.
better than the second question. So the first question, right, is how can you get help? I think the first thing is to actually sit down with your child and talk about going to get treatment and what that looks like. For many people, it's getting a consultation. It doesn't mean they're going to be in treatment for the rest of their lives, but talking to a professional who's well versed in both mental health and substance use disorders is important. And then going for a consultation, they will do all the necessary diagnostics to come up with what the co-occurring disorders are, and then come up with a treatment plan. And by the way, the treatment plan shouldn't be a secret. The family should be involved with developing that treatment plan. We know that when families are involved, typically the outcomes are much better.
Mm-hmm.
So I don't know, is there anything you'd want to add to that part of it? And then we'll go to the other part of it where the kid doesn't want to go?
Sure. For the kid who doesn't want to go, it's a more difficult task, right?
Yeah.
For that, actually, maybe you can speak about what the families can do. But from our end, the providers, we actually work on motivation for change. And there are techniques or interviewing strategies that are developed, which is called motivational interviewing, that we frequently use with adolescents and young adults to just resolve some of the ambivalence that they have in terms of their use. So if they're not, if usually kids are not sure or they don't think that it's a big problem, and this might be just because they didn't experience a negative consequence yet, or they could be in denial. So while we're talking to them, we actually help them focus on understanding and developing more insight as to what kind of an impact does using these substances have on their lives. And we try to resolve that ambivalence and get them to a place where they're more motivated to change and where they have more insight about their problems. And then when we get them there, then we work on real change and preparation for action, and then to have them commit to allowing their treaters and their environments and their families to help them. But we have to both motivate the families, but we also have to talk to the kids as well and get them ready for and get them motivated for change. Otherwise, interventions like strict interventions, they might get them to a treater maybe, but they're not conducive to long-term maintenance of abstinence or care. So we have to work with the teenagers as well.
Yeah. So, in some cases, I know families have talked to their kids about things like you have a problem sleeping. So they may have a problem with their anxiety and depression and say marijuana use or alcohol use, but they'll say, I know you have a problem sleeping, let's go talk to somebody about that. So they kind of get them in through the back door, if you will, so that they can, hoping that the treatment provider can kind of look at the whole picture and figure out what is helpful to do. In some cases, I know parents who have used some kind of positive reinforcement or incentive to get a kid to go. So it'll be like, if you go spend 8 sessions with a therapist, you'll get a girls' weekend or something like that, or the new guitar strings that you want. Probably something more than that, but in any event, the idea is that there's some kind of reinforcement that can sometimes motivate kids to go. Often there's a reluctance to deal with the substance use part of it. So sometimes it'll be easier to get them in on anxiety or depression as opposed to the substance use part of it. And I think for that, any step back, any step where they're cutting back on their use is a win. So that may be, part of the strategy as opposed to ideally getting them to quit altogether, because it will improve their overall health outcomes. Certainly linking to whatever their goals are. So if somebody wants to get in a certain college or be on the sports team and things like that, those trying to get the kids to recognize how continued substance use and their mental health problems will impact their life goals is really super important.
Absolutely.
The one thing I think it's important for people to know about this particular issue is that in some states, the child has the right to agree to treatment or not. So I always thought, if you're 18 years or older, 18 years of age or older, that the parent, that person could decide, not the parent. However, there are some states where the age of consent for treatment is younger. And so it's important to look at the state laws in your particular area to see what is required by the state, because your child may have more voice and input than you recognize.
So we can move on to our next question. What does good treatment for co-occurring disorders look like, and how do families get it, and how effective are treatments? So this is actually a very good question. Good treatment looks like a treatment that encompasses both substance abuse and mental health piece together. Because if we just address the substance use, then we're not, and if we're not addressing why the substance use started in the first place, then we're not actually doing a good job. So teens use substances for to address their anxiety sometimes
Mm-hmm.
because they're nervous, because they're bored, because they have some issues that they can't deal with and they want to numb themselves, or they have a traumatic experience that they don't want to remember and they want to silence their minds. Sometimes they just want to fit in with their peers, and that's why they're using. So there is a root cause of the substance use. And sometimes these root causes are linked to a mental health disorder.
Mm-hmm.
They are nervous because they have an underlying anxiety disorder. They are bored because they're not interested in things, or they're not taking the pleasure out of things as they used to because they're depressed, or they have PTSD due to an experience. Or they have attention deficit hyperactivity disorder, and they're so restless that they
Right.
want to calm their minds and organize their thoughts. So, in order for us to understand and target the full picture, we have to understand why the substance use is there, and when we take it away, what can we put in its place? So, usually, the treatment is a holistic treatment, and it is mostly psychosocial approaches for the substance use piece, and also a lot of changing of the environment, modifying the environment, which in a way to help and support abstinence, and also targeting the mental health disorder, whether by psychotherapy or psychopharmacology or psychotropic medications, and a lot of the times the combination of two.
So, speaking of the medications, I
Mm-hmm.
know, for example, there are kids who have bipolar disorder, as an
Mm-hmm.
example, and often medications cause other side effects like weight gain or problems with sleeping or dry mouth or whatever. So,
Mm-hmm.
how do you help your clients with those kinds of issues relative to the side effects
Mm-hmm.
of some of the medications?
Mm-hmm. That's a very, very good question. Um, for some disorders like bipolar disorder, the treatment must include psychopharmacology, and the medications that prescribe, although the newer ones are more promising,
Hmm.
they come with a baggage of side effects. Sometimes this could be increase in appetite, like in some of the mood stabilizers
Right.
and some of the second generation antipsychotic medication that we use. Um, and sometimes it has other the medications have other side effects like liver function problems, or problems with kidney function, sometimes hair loss, or acne, depending on the medication. But we have a very honest discussion with the
Hmm.
family and with the teen. Having a manic episode, which is the likely result of untreated bipolar disorder, is such a shattering and such a big earthquake in one's life that usually the families and our patients will do everything they can to avoid that
Hmm.
from happening again. It is an episode where they cannot really function, and they engage in behaviors which are so uncharacteristics of their selves,
Right.
and they often fail at school. They need to take a break from if
Hmm.
they're in college, they need to take a medical leave. If they're in school, again, they take a leave. They have problems with their peer relationships, and it takes so much time to recuperate from a manic episode. So that's why we do a very careful and thoughtful benefit versus risk assessment. We honestly discuss the results, or the both sides with the family,
Hmm.
and together we come to a decision. Usually the decision is one, picking the right medication with the least side effects. We make sure that we're on top of the side effects by monitoring the lab levels, monitoring their weight,
Okay.
um, offering them not only focusing on the medical piece, but also advising them healthy life skills, such as a good diet and exercise and good sleep hygiene. And we come to an agreement with
Okay.
with the meds.
Yeah, I know with the clients I have, because I have a small private practice in addition to the work that I do here, and I know my clients who have been prescribed medications often feel that they're feeling better.
Hmm.
And so all of a sudden they decide that they want to come off
Yes.
a medication without tapering. So
Hmm.
what in your experience happens when someone does that sort of arbitrarily?
That's a very good question, Pat. And I think, like substance abuse, bipolar disorder is a disease that we see relapse.
Mm-hmm.
And we almost always see relapse as a part of the whole treatment plan and part of recovery.
Okay.
And in any, especially in youth, bipolar disorders, they feel like they're better. They stop their medication. 2 or 3 months ago, they have another manic episode. And usually after the second or third manic episode, that the individual develops the insight that I have a chronic illness, that I have to use
To
long-term
manage. Yeah.
medications and manage. We try to minimize this by really working tightly with the families and meeting with the patient multiple times in order to build the insight.
Mm-hmm.
But sometimes, relapse is something that we can't avoid because of med noncompliance.
Okay. So with respect to the guide, right,
Mm-hmm.
I think it's helpful to know that in the guide there are questions that you can ask a treatment provider so that you actually do get the kind of quality care that you're looking for, which means asking questions about the program's staff and their credentials, asking what kinds
Mm-hmm.
of evidence-based treatments that they use, whether it's cognitive behavioral therapy or dialectical behavioral
Mm-hmm.
therapy or some of the others that are very, very effective.
Mm-hmm.
Being a part of looking at the family program that's included so that the family is supportive of what their child is going through.
Mm-hmm.
And as I mentioned earlier, just making sure that you actually see the treatment plan and know what's expected, right? And have access to ongoing
Yeah,
care.
absolutely. A good clinician has to do a careful diagnostic evaluation first. And maybe the most important job is determining the level of care that the child
Mm,
needs, whether it's an inpatient facility, whether it's an outpatient, intensive outpatient,
right.
a rehab center, or a mental health focused facility, or an outpatient medical practice like the Child Mind Institute. So the first job is to determine the level of care, and then really working with the family and the patient about the treatment plan
Mm-hmm.
and what it entails. So it's also important that families are involved. I know that, and we are very careful about confidentiality when we're working with a
It's
teenager,
important.
but you never get the full picture in substance abuse if you don't get collateral information.
Yeah.
So maybe not, maybe not giving out information, but definitely receiving information from family members is very important. And also, families need to make sure that substance abuse is also addressed in their mental health care, because this is something that you're never going to get answers about if you don't ask.
Great. So, just in closing, one more time, I feel like Vanna White here. So, here's Substance Use and Mental Health in Teens and Young Adults, your guide to recognizing and addressing co-occurring disorders. And you can get it at drugfree.org or childmindinstitute.org
Yes,
websites.
and you can also click the link in the comments section. And that's, I guess, a wrap up. So thanks for everyone
Thank you.
for joining us for this special Facebook Live.